With global attention focused on the COVID-19 pandemic in 2020 and health services adversely disrupted, the human immunodeficiency virus HIV and acquired immunodeficiency syndrome AIDS epidemic is to date far from over. In fact, the region will not reach the UNAIDS 1990 goal by 2020. This is according to the Director of the Pan-Caribbean Partnership Against HIV/AIDS, Dr. Rosmond Adams. In the targets outlined, by the end of this year, 90% of all people living with HIV were expected to know their status. 90% of all persons diagnosed with HIV were supposed to receive sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapy were supposed to achieve viral suppression. In 2019, however, Guyana was able to achieve the first 90% of the UNAIDS 2020-1990 goal, with 94% of Guyanese living with HIV/AIDS aware of their status. In an interview with Nightly News on World AIDS Day, Dr. Adams stated that the response to HIV/AIDS still remains a major challenge, with progress to bring an end to the sexually transmitted infections severely stymied by the COVID-19 pandemic.
HIV/AIDS is still a public health threat to the region and globally. We do have a lot of work to do. When we look at the UNAIDS 1990 targets, the region is not going to achieve these targets. However, this is not going to deter us from continuing our work in fighting HIV and AIDS in the region.
Meanwhile, with HIV healthcare providers now in the COVID-19 battlefield, the PANCAP Director called for self-testing, multi-month dispensing of ARVs, and the use of digital technology to offer services virtually to persons living with HIV/AIDS in Guyana and regionally.
We have to change the way in which services are being delivered. We understand that COVID-19 would cause disruption in services, and so what we have to do is that we have to look and embrace new and innovative approaches, such as leveraging the use of the virtual digital platform.
Earlier this year, former PAHO WHO country representative William Adukro called for the implementation of self-testing to reduce the number of persons who are reluctant to get tested because of discrimination and confidentiality issues. In January, the Ministry of Public Health, UNAIDS, PAHO WHO, and civil society groups commenced talks on crafting of a new 5-year national HIV strategic plan, which will seek to eliminate the disease by 2030. Outlining his suggestions on the way forward, Dr. Adams recognized the works being done across the region, but stressed the need for the general populace to do more to respond to the HIV/AIDS epidemic.
We're calling on everyone, groups, communities, and individuals to ensure that they are playing their part in responding to the HIV/AIDS epidemic.
The HIV/AIDS epidemic is now in its 5th decade. This year, World AIDS Day is commemorated on December 1, 2020, under the theme Global Solidarity, Shared Responsibility. This is being done in an effort to raise awareness, recognize health workers who dedicate their lives to bring about an end of AIDS, and remember the millions of lives lost to AIDS-related illnesses. National AIDS programs and civil society across the region continue to be challenged, especially in the area of HIV testing, as lockdowns and other COVID-19 protocols have prevented persons from accessing services. For the Age GP Nightly News, Amel Griffith.